Hi, I'm Adrienne. I'm a breastfeeding educator here at MilkWorks, and I am here today to tell you about Latch and how to make it comfortable and effective and some milk supply basics. So the first thing that you want to look for in a good latch is that baby is starting with a wide open mouth. There are a couple ways to help baby, encourage baby to open their mouth wide enough so that you are getting enough breast tissue in their mouth to make you comfortable and to make the latch effective. So one thing that you can try is kind of tickling the top of baby's lip with your nipple. That can encourage them to open their mouth nice and wide. Once they do have a wide mouth, you want to bring them swiftly to breast. You definitely want to make sure that their chin is touching your breast tissue first. This helps get more of the bottom breast tissue in their mouth and helps get the nipple way back in the back of their mouth, past their hard palate into their soft palate. Babies are born with a recessed chin, which makes it very easy to do this effectively. The reason that you want to get beyond the nipple is so that you are comfortable and that baby can use the stroking action of their tongue to effectively remove milk from your milk ducts. You kind of want to imagine your nipple all the way back here in the back of baby's mouth. You can feel the hard palate in your mouth, and then it leads to the soft palate, and that is where it is going to be comfortable for you and again effective for baby to be removing milk. If you think about how we eat or drink, we cannot effectively take a drink of water or a bite of food, swallow food if your head is turned to the side. Again, if your chin is pressed to your chest, it's going to be very hard to swallow food or drink. So you kind of think about that when you are lining baby up. We also want baby's lips to be flanged out. Again, if you're thinking of drinking from a straw and your lips are turned in, it's going to be very hard to take a drink. If you get baby on latched and comfortable, but you notice one of their lips is flanged in, you can always use your pinky finger and just kind of come in and gently help them flange their lips out. This creates vacuum pressure, it helps them stay on, and also just makes the latch a little bit more comfortable and effective for baby. You want to make sure that you are always supporting baby's neck and shoulders. You can kind of use the bones at the base of your neck or the base of your head where it connects to your neck as a guiding point. This is going to help make sure that you have lots of control when you're latching your baby, and also that they have control over their head movements as well. And you always want to make sure that baby is tummy to tummy in whatever position you are latching baby, and we're going to go over positions in just a moment. Tummy to tummy allows baby to stay nice and lined up. They're going to have plenty of breathing room, and it's going to be really easy to latch them that way. So just to kind of summarize everything I just went over, an extra thing that you can do is you can shape your breast to help allow for more of that bottom breast tissue to get into baby's mouth so that they can get and maintain a deep latch. One way to do that is kind of do a U shape if you're bringing baby in Cradle Hold. This allows you to kind of sandwich your breast into their mouth in an effective way. Again, you're bringing baby's chin to breast first. They are tummy to tummy. You're holding them with your hand right on their neck and shoulders so that you have lots of control, and they also have control over their head. Point your nipple up towards baby's nose, wait for that wide open mouth, and bring baby to breast swiftly once they kind of tick all of those boxes. If the latch is not comfortable, definitely feel free to unlatch and try again. You never want to accept a painful latch, and most babies are pretty patient if you kind of unlatch them and try again, and that is how they learn what a comfortable and effective latch feels like for them and for you. So some different positions. The laid back position in the left corner of the slide is really nice for the hospital in the early days. It can allow you to kind of relax and lean back at a 45-degree angle. Baby can really be in any position for this latch. So a lot of times, and in this photo, you see babies kind of coming up on mom's abdomen here. This is probably not a great one to try if you've had a C-section. You probably will not want to have any pressure on your abdomen, but definitely a good one to try in the hospital. You can still use your other hand to help shape your breast and latch baby. You may want to put some pillows behind your back. This can be done on a bed, on a couch. Those hospital beds move however you want, so you can make sure that you're nice and comfortable. And this is just kind of a nice way to relax and also have a pretty good visual when you're latching your baby. Another one that I found really helpful and effective in the beginning is the football hold. That is where you are bringing baby, you're still tummy to tummy, they're just coming around the side of your abdomen, and this actually is a great one if you have a C-section. It takes pressure off of your abdomen and baby is more on the side of you. You may find it helpful to have a pillow under your arm, and really in any of these positions, anything you need to do to support your arm, make sure that you're sitting upright, you're not hunched over or tense. Those are all gonna help you latch your baby more comfortably and effectively. So in the football hold, you are supporting baby's neck and shoulders, just like in other holds. You're bringing baby up from the side and you're bringing them, you are probably doing more of a C hold on your breast and bringing them up under your breast. I found this one really helpful in the beginning because I could actually see what was going on and I could help my baby latch a little bit more easily. The cradle hold is probably one of the most pictured positions with breastfeeding. That is kind of how we picture babies breastfeeding, in this comfy cradle hold. With the cradle hold, you do want to start in cross cradle, which just means you're bringing your baby across your body to latch on. This is helpful in the beginning because you have all of that control. You're helping baby latch with more of the underside of your breast tissue. And once they are latched on comfortably, you can relax into cradle hold. But if you're trying to latch baby in cradle hold to begin with, you are most likely going to overshoot your nipple. You may not be able to maintain a comfortable latch because you don't have a lot of control with your elbow. Another one that you can try is the sideline position. This is great if you are laying in bed and trying to relax a little bit more. And definitely a nice one to try to just make yourself a little bit more comfortable if you're finding that it's hard to be comfortable sitting up in these positions at a certain time of day. So some common things that can interfere with a good latch. Disorganization or lack of maturity refers to those babies who are born technically full term, they're healthy, they don't have to go to the NICU, they can be with mom right away, but they may just need a little bit extra time and help learning how to latch effectively and learning how to remove milk efficiently. So sometimes those babies need to work on that suck, swallow, breathe pattern of removing milk. And so just something to look out for with those. Labor medications can make your baby sleepy, so just something to be aware of. Circumcision, if you decide to circumcise your baby, can make babies sleepy or cranky for about that 24-hour period following the procedure. So just make sure that you are aware of that, and you may just have to work a little bit harder to wake your baby up and keep them awake and ready for full feedings. Ankylosing or tongue tie is where baby's frenulum is tight. It is that skin that is right underneath everyone's tongue. Sometimes if babies have a tight frenulum, it can make it hard to, one, remove milk efficiently, and also two, it may make mom kind of sore if baby is not able to do that effective tongue movement needed to remove milk, and also to extend their tongue enough to allow mom's nipple to get way back into the back of their mouth. So some milk supply basics. The first milk is colostrum. It's very protective. It's very good for our babies. It's exactly the first food that they need. It is present during pregnancy. And then birth triggers milk production about 30 to 40 hours later due to a change in hormones. The big change in hormones is a decrease in progesterone when you deliver your placenta, and then an increase in prolactin. Within several days though, milk supply is driven by milk removal. So yes, everyone makes milk as part of giving birth, but you really do need to make sure that you're removing milk well and often in order to sustain a good milk supply. So early and frequent means about 8 to 10 times a day. You may be more leaning towards 10 to 12 times a day, and that is absolutely fine. As many times as baby shows feeding cues, you want to let your baby nurse. But basically the kind of intervals to look for are every 2 to 3 hours during the day and 3 to 4 hours overnight. You really don't want to let it go longer, especially in the early days. This may mean you have to wake up your baby, you may have to rouse them and get them ready for a feeding, or they may be showing cues at those times. Either way, that is kind of how often you want to try to feed your baby. Milk removal is very important. Like I said, you may have to wake your baby. That first 24-hour period after delivery, babies tend to be pretty sleepy, and that is normal. Once baby is gaining well and back up to birth weight and has shown that they are gaining well, daily and weekly, you can absolutely let them sleep longer at night and let them wake you up, which is always nice. Feedings can last anywhere between 10 and 40 minutes. I don't love to put a time frame on breastfeeding sessions, but basically, if baby is latching on just for a few minutes at a time, that would probably be a red flag that maybe baby's not getting enough or latching long enough. And then if baby is consistently nursing longer than 40 minutes, up to 45 minutes or an hour every nursing session, that may mean that we need to help baby be just a little bit more efficient at breast. Both breasts should be offered at each feeding. As baby gets older, baby may just want one side, but it is really important to offer both sides and try to bring in a milk supply on both sides somewhat evenly. We don't have a lot of control over that, but we do want to make sure that baby is satiated at each feeding by offering both sides. Average daily intake, day 1 is only about our average intake per feeding, day 1 and day 2, is only about 5 to 10 cc's, which is a very, very small amount. Again, that's that early milk, which is colostrum, very protective and exactly what baby needs. They're not taking in a whole lot at each feeding, but each feeding is very important. Day 3, you're looking at about an ounce per feeding, so increasing a little bit. And then by 2 weeks old, babies are taking about 2 to 3 ounces at a feeding. And a 1 month old may be taking about 3 to 5 ounces per feeding. The size of your feedings and your baby's daily milk intake increases with age and levels out about 1 to 6 months of age. You can see here on this chart that baby's daily intake on day 1, again, is very small per feeding, and they're only taking in about an ounce total in that first day. As they get older, the size of the feedings increase, the size of, or the amount of milk they take in that 24-hour period also increases, and then levels out between 1 and 6 months and average about 25 ounces a day, about an ounce an hour over that 24-hour period. Thank you.